If you've already lost weight on one of these medications, you might think you just lost your eligibility for the $50 program. You would be wrong. And I want you to really sit with that for a second, because I know for some of you, that fear has been sitting in the back of your mind since the moment you started feeling better. And here's another one. If you're taking Ozempic right now and you're thinking, great, that qualifies me for this program, I need to stop you right there before you make a trip to the pharmacy that doesn't go the way you expect. This is the difference between paying over $800 a month for a medication and paying $50 a month for that exact same category of medication. That's not a small difference. That's the difference between a medication being realistic for your budget or not. So today, we are going deep on eligibility. Since our last video on Medicare's new $50 rule, I have gotten so many messages from you. Questions, worries, does this apply to me kind of messages? And I read every single one. So this video is my answer to you. Stay with me, because by the end of this, you are going to know exactly where you stand. Let's back up for just a moment, in case this is the very first video of mine you're watching, or in case you just want a quick refresher before we go deeper. The Medicare GLP-1 Bridge is a short-term program through Medicare. It's not permanent, and it's not experimental in the sense of being untested. It's a defined program with a defined window. It runs from July 1st of 2026 all the way through December 31st of 2027. And I want to be clear about the reach of this program too. It is available in every single state and every US territory. So no matter where you're watching this from, this program is not regional. It's nationwide. Now, under this program, if you're eligible, you can get certain weight loss medications for a flat $50 a month. Not $50 as a starting point that goes up. $50 flat. Before I go any further, though, I want to pause and tell you something that matters to me a lot. Everything you are about to hear in this video comes directly from CMS, that stands for the Centers for Medicare and Medicaid Services, and from Medicare.gov. I am not repeating something I saw floating around online. I am not guessing, and I am not filling in gaps with what sounds reasonable. This is the official source, the same source your doctor's office and your pharmacy are working from. And if a detail ever gets updated down the road, I'll always point you back to where you can check it yourself. So with that out of the way, today's video is entirely about eligibility. Because after the last video went up, the comments and messages made one thing very clear to me. So many of you were asking some version of the same question. Do I qualify? Does my specific medication count? What if my situation doesn't fit perfectly into the basic outline I gave last time? Those are exactly the right questions to be asking. So let's slow down and answer them one at a time, carefully. Let's start with the medications themselves, because this is where a lot of the confusion begins, and I don't want to rush through it. Right now, only 3 medications qualify under the Bridge program, and that's only when they're prescribed specifically for weight management. Not for any other reason, specifically for weight management. Let's go through each one individually, because each one has its own little wrinkle worth knowing. The first medication is Wegovy. Wegovy is one of the more well-known names in this category, and it's specifically approved for weight management, which is exactly the use case this program is built around. Under the Bridge, both the injection form of Wegovy and the tablet form of Wegovy count. So it doesn't matter which format your doctor has you on, injection or tablet. Both fall under this qualifying category. The second medication is Foundayo. This one may be less familiar to some of you, simply because it's newer to the conversation. But it is included as a qualifying medication under the Bridge when it's being used for weight management. And the third medication is Zepbound. Now, here's where I really want you to slow down and pay attention, because this is the detail that trips people up more than almost anything else in this whole program. Only the QuickPen version of Zepbound qualifies. Say that with me. QuickPen. Not the standard single-dose pens, not the single-dose vials. Those do not qualify under this program, even though they contain the same medication. Why does this matter so much? Because 2 people could both be on Zepbound, both trying to do the exact right thing, and one of them qualifies for the $50 program while the other one doesn't, simply because of which formulation, which specific product packaging they happen to be using. That's not a small technicality. That's the difference between $50 and paying full price. So if you are on Zepbound, or if your doctor is talking to you about starting it, this is a conversation worth having directly. Ask specifically about the QuickPen formulation and confirm that's what's being prescribed and filled. So let's do a quick recap before we move forward, just so this settles in clearly. 3 medications: Wegovy in either injection or tablet form, Foundeo, and Zepbound, but only the quick pen version. If you're on any other formulation of these drugs or a different medication altogether, that's exactly why we're doing this deep dive, so you can check your own situation piece by piece rather than assuming. Before we get into who's excluded, which is coming up next, let's cover the basic starting point that has to be true for anyone, no matter what. To use the Bridge program at all, you need to be enrolled in Medicare Part D. Now, that can look like one of two things. It can be a standalone Part D drug plan, the kind you might have added on separately. Or it can be a Medicare Advantage plan that includes drug coverage built into it. Either one of those satisfies this requirement. If you're sitting there right now thinking, I honestly don't know which kind of plan I have, please don't feel embarrassed about that. This stuff is confusing, and you are absolutely not alone in not being sure. The good news is, this is easy to check. Your plan card will usually tell you. Or a quick phone call to your plan's member services line will clear it up in just a couple of minutes. I'll walk you through exactly how to actually start this whole process a little later in the video, so hang tight on that piece. Now, let's talk about who does not qualify for the Bridge program. This is important, and I want to walk through it carefully, because I don't want you to just hear a list of conditions and feel discouraged. I want you to understand the reasoning behind it, because the reasoning actually matters. There are 3 specific health conditions that make someone ineligible for the Bridge. And here's the thing I really want you to hear. It's not because Medicare is trying to exclude you from help. It's actually the opposite. It's because, in these specific cases, you already have a more direct path to coverage. Let's start with the first one. If you have type 2 diabetes, you are not eligible for the Bridge program. Let me give you an example, so this feels real instead of abstract. Let's say your neighbor Frank has type 2 diabetes. Frank's doctor prescribes him a GLP-1 medication specifically to help manage his diabetes. Frank doesn't need the Bridge program at all because his regular Medicare Part D drug coverage already covers that medication for that specific medical reason. The Bridge exists to fill a gap for people who don't have another way in. For Frank, there simply isn't a gap to fill. He's already covered. Now let me give you a second example, just so this really sinks in. Let's say Frank's sister, we'll call her Linda, also has type 2 diabetes, but she's been resistant to going on a GLP-1 because she assumed it would be expensive. If Linda finally talks to her doctor about it, she's going to find out the same thing Frank did. Her diabetes diagnosis already opens the door to coverage through her regular Part D plan. She doesn't need this particular $50 Bridge program because a different, existing pathway already applies to her. Here's the second excluded condition. If you have moderate to severe obstructive sleep apnea, you are also not eligible for the Bridge. Same underlying idea as before. Your regular Part D coverage already includes GLP-1 treatment for that condition, so there's no gap for the Bridge to fill. Let's use an example here too. Say a man named Robert has been struggling with moderate to severe sleep apnea for years, and his doctor recommends a GLP-1 as part of his treatment plan. Robert doesn't need the Bridge because that treatment is already something his Part D plan covers directly, tied to his sleep apnea diagnosis. And picture a second person, his coworker Diane, in that exact same boat. Same diagnosis, same situation. She, too, would go through her regular Part D plan, not the Bridge. And the third excluded condition is MASH. That stands for a fatty liver disease, specifically when it comes with moderate to advanced liver fibrosis. If that describes your situation, you're also not eligible for the Bridge, for the same reason as the other two. Regular Part D already has that covered. So here is the simple way I want you to hold on to all of this. The Bridge program is specifically designed for people who want a GLP-1 purely for weight management and who don't already qualify for coverage through one of these other medical reasons. If one of these 3 conditions applies to you, please don't feel like you've been left out in the cold. In fact, you actually have a more direct, and probably more established, path to coverage already sitting right there in your existing plan. Let's pause here for a second and reset, because that was a lot of detail. 3 medications that qualify, a basic plan requirement, and 3 specific conditions that route you toward your regular Part D coverage instead of the Bridge. Take a breath. We're going to keep building on this, piece by piece. Okay, this next part is, without question, the single most common question I got after the last video landed. So I am going to slow way down here, and I'm going to explain this 2 different ways, because I really want it to click for you. Here's the first way to understand it. Ozempic and Wegovy actually contain the exact same active ingredient. It's called semaglutide. Same molecule, Same core medication, chemically speaking. But, and this is the part that matters, Ozempic is only FDA approved for type 2 diabetes. Wegovy, on the other hand, is FDA approved specifically for weight management. The Bridge program only covers medications that are prescribed specifically for weight loss. So even though Ozempic and Wegovy are, at the chemical level, the same drug, Ozempic does not qualify for the Bridge. Wegovy does. Now let me say it a second way, because I think this helps it land differently. Imagine two people standing side by side, and each one is holding what looks, from the outside, like the exact same medication. Same shape, same kind of pen, same active ingredient inside. But one person's prescription paperwork says prescribed for type 2 diabetes, and the other person's paperwork says prescribed for weight management. Only one of those two pieces of paperwork opens the door to this $50 program. It's not really about the drug sitting in your hand. It's about what it was written for. The purpose on the prescription is what determines eligibility here, not the ingredient list. So if you're on Ozempic today and you were hoping that meant you qualified for the Bridge, I know that might be disappointing to hear. But I'd rather you know that clearly now, from an accurate source, than find that out the hard way at the pharmacy counter. And if weight management is genuinely your goal, that's exactly the kind of thing to bring up directly with your doctor. Because Wegovy, prescribed for that purpose, is the one that fits under this program. Let's pause here for just a moment, because I know we've covered a lot of ground already, and I don't want you to lose the thread of why any of this matters. Here's what I want you to hold on to. This program has the potential to take a medication that might otherwise cost you well over $800 a month and bring that cost down to $50 a month. That's the entire reason we're doing this deep, detailed video, not to overwhelm you with rules, but to help you figure out, clearly and confidently, whether that kind of savings applies to your own situation. So if you've been listening and thinking, okay, but does any of this actually apply to me? Stay with me, because we still have some of the most reassuring, most practical parts of this video still ahead, including one question that I think is going to bring a lot of relief to some of you watching right now. This next question came up again and again after the last video in message after message, and I have to tell you, I really love this one because the answer is genuinely good news, and I think a lot of you need to hear it. Here's the scenario. Let's say you started a GLP-1 medication sometime before July 1st of 2026. At the time you started, your BMI was above the qualifying threshold. That's part of what made you a candidate for this kind of medication in the first place. But here's the thing. The medication has been working. That's the whole point of it. And now your BMI has come down. Maybe it's come down quite a bit. Maybe it's even dropped below the threshold that would normally be required to qualify. So the natural, worried question becomes, does that mean I've lost my chance at the Bridge program simply because I did what the medication was supposed to help me do? And I want to say this clearly and slowly because I know this fear has probably been sitting with some of you. No, it does not mean that. You have not lost your eligibility. Here's why. Your prescriber, your doctor, can attest, meaning they can confirm in writing, that you met the qualifying criteria at the time you first started the medication, not at the time you're applying for the Bridge. At the time you started treatment, originally. That's the moment that matters for this particular rule. So if you've been putting in the hard work, sticking with your treatment plan, showing up to your appointments, and actually seeing real results on the scale, please don't let yourself assume that progress somehow disqualifies you from this program. It doesn't work that way. What I'd encourage you to do is talk to your doctor about this specifically, using the language we just went through, so they know to document your original starting point clearly and accurately for the record. Now, some of you watched our earlier video about Extra Help. That's the program designed to help lower-income Medicare beneficiaries save money on their drug costs. And I want to pause here and be very, very clear about something, because I don't want any confusion carrying over from that video into this one. Extra Help and the Bridge program do not combine. I'll say that again, because it's important. These are two separate programs, running on two separate tracks. Extra Help savings cannot be applied to a claim under the Bridge. So what does that actually mean for your wallet? It means that if you qualify for the Bridge program, your cost is that flat $50 a month. That's true, no matter whether you also happen to have Extra Help through your regular Part D coverage. The two don't stack, and they don't reduce each other. And I'll add one more detail here that's worth remembering. That $50 does not count toward your Part D deductible. It exists entirely on its own track, separate from the rest of your drug plan's normal cost structure. I know that might feel like a slightly disappointing detail if you were hoping the two programs would combine for even bigger savings. But I'd rather you walk into this with the accurate picture, so there are no surprises later. So, with all of that eligibility information now on the table, how do you actually get the ball rolling? Here's the good news. This part is simpler than a lot of the rules we just walked through. You do not need to contact your Part D plan directly about this. And here's something that surprises people. Your plan doesn't even need to formally opt into the program for you to be able to use it. Instead, approvals for the Bridge program go through what's called a central processor. That central processor is Humana. And if that name sounds familiar to some of you, it might be because Humana already runs a program called LINet, which some of you may have encountered before in a different context. That existing infrastructure is what's being used to process Bridge approvals. So here's the actual, practical first step, in plain terms. You talk to your doctor. From there, your doctor is the one who submits your prescription, along with something called a prior authorization request, directly to that central processor. That's the mechanism. You don't need to navigate this piece by yourself, and you don't need to call your insurance company first. So if, after everything we've covered today, you think you might qualify, your very next move, the one actual action step to take away from this video, is a direct conversation with your doctor. Before we wrap up, let's do a full recap of the mix-ups I hear most often, so that you walk away from this video feeling clear and confident, not just informed. Mistake number 1. Assuming Ozempic qualifies simply because it shares the same active ingredient as Wegovy. It doesn't qualify. What matters is what the medication was actually prescribed for, not just what's inside it. Mistake number 2. Assuming that any version of Zepbound counts under this program. Only the quick pen formulation qualifies. The standard single-dose pens and vials do not. Mistake number 3. Assuming that losing weight on your medication somehow means you've lost your eligibility. It doesn't work that way. Your prescriber can attest to your BMI at the time you originally started treatment, and that's the moment that counts. Mistake number 4. Assuming that extra help stacks on top of the Bridge program for even bigger savings. It doesn't. They are two separate programs, and they don't combine. And mistake number 5. Thinking you need to go through your Part D plan directly in order to apply. You don't. The process runs through your doctor, straight to the central processor, without your plan needing to be involved in that step at all. I really hope this cleared up some of the confusion that came out of our last video. My whole goal with these videos is simple. I want you to walk away with real, accurate information, straight from Medicare's own guidance. Not rumors, not guesses, not something a friend of a friend heard, so that you can walk into your doctor's office and have a genuinely informed, confident conversation. If this video helped you today, please take a second and hit subscribe so you don't miss the next one in this series. Because I promise you, there is more coming, and your questions are exactly what shapes what I cover next. And most importantly, if any part of what we talked about today applies to your own situation, please don't sit on it. Bring this information with you and ask your doctor directly whether the Bridge program could be right for you. Take care of yourselves, be patient with this process, and I will see you in the next one.